to Vitals and Vibes, where we check the vital signs of healthcare, culture, and leadership. And we don't just talk facts, y'all. We talk about the feelings, the history, and the truth. I am Dr. Leonora DNP, and it is Black History Month, y'all. It is February 2026, and today's episode is not a light listen, it is a necessary one, y'all. So check these vitals. Because Black healthcare didn't just participate in medicine, Black healthcare built medicine as we know it. And so today I want to walk us through something that often gets minimized, erased, and reduced to a footnote: the foundational contributions of Black nurses, Black physicians, Black hospitals, and Black midwives to U.S. healthcare. And that's not just history for history's sake. It's about personal identity. It's about why representation matters. It's why I do what I do, y'all. And this is about why Black healthcare professionals still lead innovation today, even though and oftentimes without credit. So I want to start this conversation off talking about the backbone of care. And who is that, y'all? It's Black nurses. So let's start talking about Black nurses, because nursing has always been in the forefront. Before integration, our Black nurses, we staffed those segregated hospitals, we ran those training schools and the programs, and we provided public health services when nobody else would do that job. And we delivered care in the homes and in the churches and in those community centers where the care is needed. Those nurses was walking all around those neighborhoods, making sure that they educated those people on how to take care of themselves, how to advocate for themselves, what to do when they didn't know what to do or didn't have the means and the know-how to take care of their families. Those nurses was out there. And today, Black nurses currently make up about 12 to 14% of the U.S. nursing workforce. Yet, Black communities experience disproportionately worse outcomes in maternal mortality. I talked about that not too long ago on a live. Also, chronic disease and life expectancy. And that gap is not just because Black nurses aren't capable, it's because the systems were never designed with equity in mind. And so the real contributions that Black nurses did, they pioneered community-based care. Like I said, they were in the community. They were doing the preventative health education in the community. They was talking about chronic disease management long before it became a buzzword that we now say. They wasn't just following orders of those physicians. They was out there building care models from scratch. That's what those Black nurses was doing. And so now I want to talk about our Black physicians, because we can't leave them out, whose their contributions change science, but often at a personal cost. And one of those well-known examples is Henrietta Lacks. Those cells are still used today in cancer research, the vaccines, and medical breakthroughs. And if you don't know about her, her contribution advanced modern medicine globally. So you need to go and check out, read a book, Google it, go on ChatGPT and go on the chat and see what it's telling you about their history, because you need to know about it if you don't know about her. And still to this day, her family received no consent for using those cells, no recognition or compensated for decades they went through with not being compensated. And so real quick, some Black stats: Black physicians make up only 5 to 6% of U.S. doctors, y'all. Yet the research shows that Black patients often have better outcomes when they are treated by racially competent providers. And that's not just a coincidence. It's about trust. It's about that cultural understanding of how to take care of Black patients. And that's advocacy in action. And those Black physicians, they don't just treat the illness, they challenge those racial medical myths that's out there, that biased diagnostic standards, and the exclusion from academic medicine. But I also want to talk about a little bit that touches home: Homer G. Phillips Hospital. And if you don't know nothing about Homer G. Phillips Hospital, you need to learn about it. Go on the chat, go on to Google, go on and search it up right now. Take some time, hit that search button, open up another window and pull it up. Homer G. Phillips Hospital. And I got to talk about it, and I got to pause about it, because this is St. Louis history. Where I'm from, St. Louis, Missouri, Homer G. Phillips Hospital was one of the largest and most advanced hospitals in the nation. It was the first Black hospital on the west side of the Mississippi River, and it was staffed primarily by Black physicians and Black nurses. And it was a huge, major training site for Black healthcare professionals. So let's be clear, this hospital was not just good Black hospital, it was an excellent Black hospital, period. Because those physicians that trained there and those nurses that trained there, they went on to lead departments nationwide. They also established private practices. We had some alumni of Homer G. Phillips that had private practices here in St. Louis that are still going strong today, when their children and their children started and continued on with the practice and have really raised half of the Black community in the north side of St. Louis, and delivered those babies, and provided that practice and the pediatricians for the Black people in their community. And that is still happening today. They actually shape modern medicine education. And yet, when desegregation happened, instead of integration with equity, many of these Black institutions were dismantled. And actually, my mother-in-law, Lamore Smith, God rest her soul, she worked at Homer G. Phillips Hospital. She was a laboratory technician, and she actually went to jail on the day they abruptly tried to come and close the hospital. This was August 17, her actual birthday, 1979, they abruptly closed Homer G. Phillips Hospital. And, that disrupted a care in that community. Those communities lost a trusted care center in their neighborhood, and that loss still echoes today. And my mother-in-law knew how important it was to stand up and fight to try to keep that hospital open, because they knew the level of care that was provided at the hospital. They knew what that meant for the Black nurses that were training in the School of Nursing. They knew how important it was for Black patients to be taken care of by Black providers, because they understood how much that was important. And that loss, like I said, still echoes today, and is something that's lost and we have never gotten back. So next, I want to talk about the Black midwives, because before hospitals dominated birth, the Black midwives, especially in the South, down South, where they were the maternal health leaders. They were the ones that were delivering those babies safely. They were the ones that knew how to provide that prenatal and that postnatal care, and how to educate those families on nutrition and hygiene. And they really were the ones that reduced maternal and infant mortality rates that we have not seen, that has been long gone. Because in the early 1900s, those midwife-led care showed strong maternal outcomes. Now, fast forward to today, Black women are 3 to 4 times more likely to die from pregnancy-related causes. And that's not progress, y'all. That is a systemic failure that we are still trying to rectify today. That's why we're marching on Capitol Hill. That's why we're talking to our legislators, talking about Black maternal health and mortality. That's why it's continuing to be a conversation. And now, I'm so glad about this. Now, modern maternal health initiatives are now circling back to, now we bringing back the doulas. Get you a doula, sis. And if you don't know, you better find you a doula. If you are pregnant, looking to get pregnant, you need to start looking now. Find you a doula. And I said sis, but we also talking about bros too, because we got some single Black fathers out there. And if you don't know nothing about a doula can help support you throughout that pregnancy. And you need to learn about community birth workers and midwifery and what that means. We got more ladies going back to midwifery school. I know an awesome doula. I know a couple of awesome doulas out there. And some of them in midwifery school right now, chucking it up, because they know how important it is for Black maternal health. And that means that we just rediscovering what Black women knew already, that they need us. We know how to do this. We've been doing this for many, many years. Our ancestors have passed down all of the knowledge, the tradition, and we know what we're doing. And so now we're bringing it back. Now we're rediscovering this history that has been lost. But let's talk about the part that people don't like to talk about. Black healthcare professionals weren't good enough to build the system, but somehow never deemed good enough to lead it. But our knowledge was used without our credit, like I talked about earlier, replicated without compensation, and dismissed until rebranded by somebody else, the mainstream institutions. And yet, the Black nurses, physicians, and the midwives, we keep showing up every single day anyway, because we are resilient, we are built in excellence, and it is our legacy. So, the reason why I'm talking about this today is because this history matters, because it shapes how Black professionals, how we see ourselves. When our little kiddos see that Black professionals are out there being midwives, being out there being physicians, and being nurses, then they see themselves in us. And they see an example that they can live by and that they can strive to do. And it explains, this history explains distrust in the healthcare system. So we got to keep talking about it, y'all, until we see the equity happening, where we see those disparities decreasing. And this history matters because it validates why advocacy is part of all of our jobs. It's not just a nurse job. It's not just a physician's job. It's not just Black people's job. It's everybody's job to advocate for and remember the history. And that's why it's so important for us as professionals to know our professional lineage and where we came from and how we came about, so we can stop asking for permission to lead and do the things that we already know we need to do. So here's your vitals and vibes action for this week. This week, I want you to learn one Black healthcare contribution that you were never taught. So look it up, Google it, search it, whatever you need to do. Look up a Black healthcare contribution that you were never taught, because we have done plenty of things that we have not gotten credit for, that has been lost, forgotten, stuffed under books, tried to sweep under the rug. Figure it out, pull it out, roll that rug up, because we need to learn about it, and share it with a colleague, a student, a teacher, a patient, whatever, and say the names of those individuals, because they cannot be forgotten. You need to tell those stories, because knowledge is power, as we all know, but shared knowledge is liberation. So this week, your challenge is to comment under the comments, and don't forget, you need to like, subscribe to this, and comment one Black healthcare contributor or institution that helped influence you. Because many of us have went to excellent schools. Many of us have learned from the best. So comment and put their names out there so we can remember them, so we can honor them while we can. So if this episode resonated with you, please like, subscribe to Vitals and Vibe DNP on YouTube, and share this with a nurse, a student, or a healthcare leader, because Black healthcare history is American healthcare history. So until next time, protect your purpose. I want you to honor your legacy, and always check these vitals. Next time. See you next time. But these bitches in my business, coming out, you're choosing violence. If you see me out in public, you don't know me.